Good afternoon, everyone, and welcome to Flint LEADS, which is a program of the National Minority Quality Forum. And we appreciate you taking the time to join us. I think what we want to try to do today, we've been in Flint for a number of years, and some of you know some of the NMQF staff, and some of you don't know us. And so we wanted to take this opportunity to introduce the full NMQF staff to you, as well as to talk a little bit about Flint LEADS and the work that we're doing. I'm going to call your attention to the words local empowerment to advance detection in science, because this work is really about collaborating with community, listening very carefully to the healthcare challenges and things that you face, and to see how collaboratively we might work together to help improve the quality and access to care that you have. I'm going to ask Dane, who's our Zoom master here, to advance the slides, and I will do that along the way. So Flint is not the only place where NMQF is doing this work, and that's why we call it the LEADS Network, because our hope is down the road, we're going to connect communities across the country that are facing similar problems. And one of the problems that we're paying a lot of attention to is communities that are experiencing exposure to environmental risk. When you look at our healthcare system, it really doesn't react to environmental risk. You can be a cancer cluster, and there are some in the network that have been identified as a cancer cluster, but it doesn't mean anything. And when I say it doesn't mean anything, it doesn't mean that you get extra monitoring, that you get a special designation, that the system from a clinical standpoint has established guidelines and risks to acknowledge and try to provide good quality care for you. And we think that there's something there. When you're living in an environment, if you read the literature, what it says is that you have higher risk for cancer, for Alzheimer's, for diabetes, for asthma, for lupus, for Parkinson's. I mean, there's a whole list here. And there's good science that is coming on stream that can really help. And that's really the point, is how do we come together and really help? So the National Minority Quality Forum, really, just a little bit from our lens, our vision is really to reduce patient risk. We want to keep you out of the hospital, keep you out of the emergency room, keep you from disability, make sure you have a high quality, long life. And that's really what the mission of NMQF is all about. Next slide. And so this is a little bit of the NMQF team, but I just want to quickly give you some oversight to the internal workings of NMQF, and you're going to hear from each of the centers. So NMQF is organized around 6 centers, and I won't spend the time here to name them because you're going to hear from the center leads, and they're going to tell you a little bit about the work they do. When they all come together, we call that one NMQF, and it's one NMQF that's reaching out to the community in Flint and Houston and other places around the country. And so let's start off with some introductions. And so next slide. And I want to introduce you to the PIs for the study. So we're actually doing a study in Flint. We're enrolling, to begin with, 200 individuals to participate in the study. And we're collecting a lot of information and hopefully learning a lot. So one of the things we're trying to learn that's really important is that there's new science. The new science is called early detection. And what that means is before you become symptomatic for cancer, there are new screening modalities that suggest maybe 5 years before you're symptomatic, we can see that cancer. Or with Alzheimer's, 10 years before you're symptomatic, we can see the onset of Alzheimer's. Diabetes, similarly. So we are collecting and doing those tests at the population level, meaning we're trying to understand what does pre-symptomatic, and that's the word we use, pre-symptomatic cancer look like in terms of numbers in Flint or in Houston or in other places around the country. And Dr. Otang and Danica Dalton are the PIs for the study in Flint. And I'm going to let them introduce themselves and tell you a little bit about their work. So I'm going to turn it over to Danica and have her tell you a little bit about what she's doing.
Thank you, Dr. Parker, and National Minority Equality Forum. Hi, everyone. I'm nurse practitioner Danica Dalton, and I am the sub-PI for the study. We're excited to be a part of the study. Dr. Rocky, I'm not sure if he was able to sign in or not. He is currently working a shift in emergency medicine. He is a board-certified emergency medicine physician and world-renowned global researcher. He's employed by the University of Michigan, Ann Arbor, or Michigan Medicine, where he teaches clinically and he works clinical. So that's Dr. Rocky. He's been doing research, I think, for about a good 20 years now. He's helped establish many facilities all over the world, but one of his main focuses was Ghana. He helped establish an emergency medicine hospital and a standalone practice where he's going over there and he's teaching the students and training them in emergency medicine as well. So that's Dr. Rocky. Myself, I am a born, raised Flint native. Born right here at Hurley Hospital, the city hospital, grew up in Flint all my life, went away to school and came back home. Came back home with a passion to help and help even more when cancer impacted my family. So over the past 8 years, cancer has taken a toll on my family, but over the past year and a half, I've come in contact with people like Ms. Sharon and Dr. Puckrin who pushed me into my assignment. And so I'm here with you guys today as your primary or your sub-investigator for this cancer research study.
Great, thank you very much. Dane, you want to click on to the next slide? So I've told you a little bit about the LEADS initiative, and I'm not going to go any deeper into it than that. Right now, we are enrolling 200 folks into the study. It is the beginning of a process, and really what we're trying to do is really learn, because as this new science begins to take hold, we really don't have good metrics in terms of understanding disease before it's symptomatic. So if you go to a doctor right now, basically he's asking you questions to try to understand your symptoms. And there's a set of protocols that get established once he understands what symptoms you have, how to screen you, how to treat you, et cetera. What we don't have is those kinds of protocols and signals for pre-symptomatic, before you're actually presenting with the disease, even though what we're now learning is that disease is already taking hold in your body. And so that's the work that we're undertaking. Next slide. So this is the Office of the President. This is my direct staff, and couldn't do anything without him. I want to give a quick shout out to Brandon Garrett, who's my Chief of Staff. Brandon has started working with us. He used to work with Congressman Kelly in DC, a member from Chicago. He's also worked at the White House, and he is really a consummate professional, and really couldn't do the work without him. Cecilia Masters is a director of our philanthropy and finance management, and she's in charge of the blood flow of the organization. How do we get the support so that we can do the work in Flint and other places? Sharon Thomas, many of you have met Sharon. She has been in Flint, was part of the town hall that we did in Flint last January, and she's the one that makes the ship run as it relates to the work that we're doing in Flint. Catherine Chavez, many of you know Catherine. She's worked with FC3, and thank you for a grant that we got from the Michigan Department of Health, and she's been working on the surveys with you, and we've learned a lot. We pay a lot of attention to what you tell us. We can't go any place unless you tell us. where to go, how to go, what you want. And so Katie's been really super strong in bringing that information to us. Raven Parker works for Cecilia on the grant work that we do, and she's always making outreach and is really an important part of our staff. Kanisha Adams is my assistant. She keeps my calendar, keeps me on time, and makes sure that I show up where I'm supposed to show up. And Margot Payne has been our business manager. Margot's been with us probably about 25 years, Margot. I think that's about right. And she's been really important to the organization. Next slide. I'm going to turn it over to Kayla Emeru and let him tell you a little bit about his center.
Thank you, Dr. Parker, and good afternoon, everyone. My name is Kelly Emeru, and I lead our Center for Professional and Strategic Alliances. What that means is we serve as the hub for professional groups. But before I tell you more about our center, I also wanted to introduce my teammate, Michael DeSalvo Solarte. He is a project manager and serves on the team as well. So if you go to the next slide, it'll show more about what we do and who we are. As I said, we serve as the hub for professional groups. And really, we bring alliances, healthcare professionals, researchers, and even communities such as yourself together, advocates, all to focus on one goal, which is to reduce healthcare disparities in a way that's practical, measurable, and sustainable. So a lot of what we do is it sits at the intersection of the strategy and connecting the professional groups, the data, and then working on the implementation on the ground. So we help manage these professional groups and support the cross-sector partnership. So I'm no stranger to Flint. I've been there many times. I grew up in Minneapolis in the Midwest and been to Flint many times. The last couple of times I was there, it was through the work that we were doing with NMQF and in the early days of CSSI. So I'm happy to continue working and looking forward to meeting many of you. Thank you.
Great, thank you. And when he speaks of Caroline speaks of professional groups, he's really talking about physicians and those who are delivering care, and we try to work closely with them on guideline-directed care, supporting advocacy, and making sure that you're getting access to best possible medicine, collaborating both at the local level as really and at the national level. And he manages groups of clinicians and really takes some of the questions and the things that you're asking us, because we're not clinicians, and making sure that you get good answers from those who are delivering care. Next slide. I'm going to turn it over to Leo Zhu. Leo, do you want to introduce yourself?
Good afternoon, everyone. First, I'd like to briefly introduce our CCSR team, NMQF, Center for Clinical and Social Research. Christina Edward, our Director of Clinical Trials. Christina is not on camera. She's joining by phone. Some of you may have already met or worked with her. If so, you know she's amazing, an outstanding collaborator in clinical research. She brings extensive expertise in clinical trial management, regulatory compliance, and study implementation, with a focus on pulmonary and critical care, pediatric gastroenterology, and CNS research. She's been a tremendous asset to our team. My name is Liu Zhu, and I serve as the VP and Senior Principal Statistician CCSR. My background is in biostatistics, health outcomes, and large-scale healthcare data analytics. I lead our healthcare data equity project, where we work with Medicare and Medicaid claims data to better understand healthcare disparities and outcomes across diverse patient populations. Next slide, please. I'll provide a brief overview of CCSR. The Center for Clinical and Social Research is dedicated to advancing equitable healthcare through scientific research and data-driven insight. Our team brings expertise in biostatistics and epidemiology, with research experience across a wide range of therapeutic areas. We work closely with community organizations, academic institutions, healthcare providers, and industry partners to ensure our research addresses the needs of the population we serve. CCSR's work is organized around three major pillars. The first is the Alliance for Representative Clinical Trials, or ARC. This is a public-private partnership focused on improving diversity in clinical trials by bringing research opportunities directly into minority and underserved communities. The second pillar is the Minority and Rural Coronavirus Insight Study, or MRCIS. This multi-sponsored initiative was established during the COVID-19 pandemic to investigate disease, infection, vaccination, and related health outcomes among racial, ethnic, and rural populations that have historically been underrepresented in research. The third pillar is the Healthcare Data Equity Project, or HDAPS, which is the program I currently lead. HDAP is a research initiative that uses large-scale Medicare and Medicaid claims data to examine health outcomes, health disparities across a broad range of therapeutic areas. Our goal is to collaborate with industry, academic partners, and other stakeholders to generate real-world evidence that highlight healthcare disparities and support more equitable care, particularly for vulnerable and underserved populations. At high level, HDAP combines robust data analytics with policy-relevant research questions. We study disparities in healthcare access, utilization, treatment patterns, and other health outcomes, translate those findings into evidence that can inform future research and clinical practice. Beyond data analysis, we have a strong foundation in scientific writing and communication. Our team has contributed to numerous peer-reviewed publications, ensure that our findings reach the broader community. We look forward to continuing these works and expanding our impact. Thank you. I'd like to turn it over to next slide.
Yeah, I just want to, before I introduce the next group, I just want to give a shout out to Leo and the team. She's being modest. They've published in world-class journals that have literally changed health policy. That here in Washington and at the state level, the research and work that they've done have absolutely changed health policy. And we take that information that you give us along with data that we collect, and then we turn that into peer-reviewed papers. Venkata, please.
Thank you, Dr. Parkman. Hello, everyone. Venkata Chitela here.
You have to speak up, Venkata.
Oh, sorry. Venkata Chitela here for leading the Center for Health Information Strategy and Services. I lead as a director for data engineering, and I have Adam Gross here as a consultant and IT administrator. Together, our team builds and operates the secure data infrastructure, analytics, and technology system that powers NMQF mission to eliminate health disparities. So next slide, please. Our job is simple to say and hard to do. Turn data into evidence and evidence into action. And at the core of that is our own private cloud, where we have more than 5 billion patient records that lets us study health outcomes at the community level and ground everything we do in real evidence. The vision is a future where data serves health equity, so every community, regardless of zip code, benefits from systems that surface the truth about their health. For Flint especially, you can see that in one of our two featured programs, which is community-specific cancer risk maps and environmental health education tools that show you clearly how contamination concentrates where people live, putting that evidence in the hands of advocates and policymakers who can act on it. And we are making that intelligence easier to reach with Chat NMQF, an AI assistant that's built in-house that let our teams and partners ask questions for our data in plain language and get answers in seconds, turning the whole 5 billion patient record warehouse into something you can actually use. So that's on a high level about the health information strategy and our team. Back to Dr. Pakran.
Yeah, thank you so much. And I want to give a shout out to Adam as well. Both Venkata and Adam manage a private cloud. So NMQF, yes, we have our own private cloud secured by government standards, and we collect a lot of data, and it's being used by Leo and the team, and actually making it available to community folks as well as we try to drive a data-driven healthcare system. Next slide. Munira, I'm going to turn it over to you.
Good afternoon, everyone. My name is Munira Bangi, and I lead the Center for Sustainable Healthcare Quality and Equity. And part of my team is Laurelie Hall, Chini Ukachukwu, and Leslie Zuniga, and we make up the SHC team. So what do we do? Well, our center works with community organizations to build on-the-ground partnerships. We work with faith-based organizations like our churches. We work with community health champions and local leaders. If you're a barbershop or a hair salon or a nail salon, most likely we'll get in touch with you. What we do is we turn health education and awareness into real action. And wherever we go, we build sustained relationships. So you'll see us around for the next few years. We'll be in your community. We'll be doing a lot of work. Some of you on this call have already seen me in January. I was at the town hall. I was registering you guys. I was at the table, so I know many of you already. And then my team, especially Chinny and Leslie, they've been working with the churches, and they've had many conversations with many of you about events coming up. So next slide, please. And so some of the programs that we do quality improvement programs in communities. That's our DRIVE program. We work with community pharmacists to ensure that we do awareness campaigns through them. We work with our churches, our Faith Health Alliance. And so we connect churches across the country, and then we have a group of pastors that work together. And so we're looking forward to do that in Flint as well. It's just making sure that every community throughout the country is connected. We're all working on the same issues throughout the country. So we continue to look forward to working in Flint. Thank you.
Thank you so much. Next slide, Dane. So this is our Center for Communications, and I'm going to ask Angela to tell you about her team.
Hello, everyone. Thank you for joining us here tonight. I'm Ajwa Chimartin, Vice President of Communications and Public Affairs, and this is the comms team. I'm really excited to introduce to you all, if you've not met her already, Taylor Lopez. She's our Director of Health Communications and is responsible for our Lift Every Voice patient education program, but also all the wonderful materials that you might have seen that come from NMQF that really help to make what is often complex information understandable and digestible. I'm sure you've met Victor Mejia Lacayo, our Director of Marketing, who does all the outreach, all the cool designs you've seen in your communities, whether it's on TV or on radio, or anywhere on social media. It comes from the brain of Victor. And then we have Dane White. Dane is the glue. You've seen so many emails from him, and you might not have known that he was behind it all. Dane White is the glue of our team as the manager for internal communications and project management. We have Subhash Kafli, who is our associate for digital marketing and has made sure that all of you were here today. And so we really are grateful for his dedication. And then Jessica Wilson is our associate on social media. And I can't wait for you all to really get into it with this team, with the webinar that will be after this one, as we look for social media influencers amongst you all to help spread the word about LEADS and the first model detection cities of America. Next slide. So our team and our center is really focused, as I've said, on patient education, on health communication, and which is so critical nowadays when communication is often mired by misinformation, disinformation, and that, often it's sometimes even hard to attain in a lot of communities. So that's what we're focused on. Also, patient advocacy, stakeholder partnerships, and community events and activities that help to educate on a variety of health topics. We have an expertise in health education, multicultural marketing, health literacy, particularly in the lens of health access and health equity. And we love to translate science and data into actionable messaging that are relatable to all of you. Our featured programs is For Your Health News. If you've not already subscribed to For Your Health News, boy, are you missing out. We have correspondents right from Flint, actually, and have covered news from Flint. So they were covering our last town hall meeting and continue to capture stories from the ground on our For Your Health News website. So that's foryourhealth.news. Pretty simple to remember. And then our Lift Every Voice program includes all of our patient networks in different disease areas. And this is where we really engage and help people get referred to resources and critical information to meet their needs. Next slide. One thing that we wanted to share with all of you was one of our surveys of Flintstones, as they're loved to be called. And so here just shows you that our work is very much patient-led. It is informed by the community. And here are the findings that show why we're here today. You know, that there are environmental concerns, that there are health concerns coming from the community. We would like to increase awareness of early detection tests. And so we would like to see that number that's at 35.8% increase really by the end of the year, next year. So we will continue to track this and inform our stakeholders in the community about how well we're doing to increase awareness of early detection tests. But we really are encouraged by how many respondents said that they would take a blood test to understand their risk for cancer. So 72% from the community said that they're ready for this. They're ready to lead as the first model early detection city in America. 87% believes that early detection saves lives. And with that, that just tells you that this is the community that just needs the tools and the resources for a healthier future. And so we really appreciate it, and we look forward to engagement in the future.
Next slide. So I'm going to ask Gretchen Wortman to introduce her team. Gretchen, I think you're on mute.
Well, I certainly was. Okay. Good afternoon. My name is Gretchen Wortman. I am Vice President for Policy and Program of the National Minority Quality Forum. And in that role, I direct our Center for Public Policy. I have a long background in health systems planning and health services management. I was actually, I was born in the city of Detroit at what was at that time Women's Hospital and then became Hutzler Hospital. I'm not sure it's still there. But in my professional life, I also worked with the Greater Detroit Area Health Council as a senior health systems planner with the Comprehensive Health Planning Council of Southeastern Michigan. And in those roles, my responsibility was to assess the health needs of residents of Southeastern Michigan, to conduct certificate of need reviews, of which some of you may be aware that were an interesting part of health systems planning in the 80s and 90s. And as part of that health systems planning, a fair amount of effort was spent assuring that the capacity of the system in the counties of Southeastern Michigan were aligned with not only the needs of the residents of Southeastern Michigan, but their location. I am not prepared to say that we were wildly successful in that regard, and I think a significant challenge is that those efforts, and currently too many efforts, are focused on cost, on containing the costs of healthcare. And what the National Minority Quality Forum is doing and has been in the 20-some years I've worked with Dr. Puckrin is to assign priority to reducing patient risk and assuring that our partners in the public and commercial sectors understand the value of patient risk as a priority. I am joined today by one of my team, Dr. Britt Weinstock, who is our Senior Director for Federal and State Policy. Dr. Weinstock has, I would say, an interesting mix of experiences as well. She spent some time with the Washington Business Group on Health and with Families USA. And when we started working with her, when I started working with her, she was policy director for the Congressional Black Caucus. Why did I just go blank?
Congressman Christensen.
Health Brain Trust, the CBC Health Brain Trust with Congresswoman Donna Christensen. So the next slide, please. The Center for Public Policy has broad responsibilities for articulating and advancing a policy construct that assigns priority to research designs that assure the statistically significant inclusion of all population cohorts, for treatment and payment paradigms that provide maximum flexibility in care delivery, and for advancing pricing paradigms that incentivize innovation. I will say that some of you may be aware that that's an interesting challenge right now, given some of the values that are being advanced by the current authorizing environment. But that's also part of the challenge of anyone who's working with legislative and regulatory policy, which is protecting the advances of the past while promoting a system in the future that is aligned with the human beings on whose behalf we are working, rather than only the financial needs of certain components of the system. Britt, I don't know if there's anything you want to add to that.
No, well, no, it was perfect.
She didn't know I was going to say that. Okay. So anyway, thank you. And I return the podium to Dr. Puckrin.
Yeah, next slide. So we plan to do some upcoming webinars, and here's some dates. NMQF loves to do webinars, and these obviously will be an opportunity for the community to ask questions. We'll bring experts to you to try to have them share and listen to your thoughts and comments. And we always take that back, and we learn a lot from these communications. And so we see that as part of our role, which is to find real experts out there who are leading in innovation, and have them come to your community in person or as well as in webinars, and give you a chance to ask questions and learn. We always find it incredibly important for us to learn from you. I just put a note in the chat that if you have some questions, because we're going to open up for questions in just a minute. If you go into the chat and put in your questions, we'd love to hear from you. If you've got questions about NMQF, about the study, about whatever, we love to hear from you. We always learn a lot from the community, because it is not just your experiences, but we also take those back and help our healthcare system understand the needs of the community, what they're advocating for, and to the best of our abilities, how do we make that happen? At the end of the day, healthcare is about advocacy to a large extent. And if you're not advocating, you're probably not going to get. And so we put a great stock in what we call learning from those community voices, and we pay attention to them quite a lot. So these webinars are really organized to do that, and we encourage you to join with us and learn. And down the road, we'll be connecting you to others in community who are sharing some of the challenges and some of the benefits that you see in our healthcare system. And all is not bad. There are really good things going on that we want to share as well. And so it's out of that collaboration. So those webinars, you'll be getting notices about them, and we hope that you will join us. Next slide, Dave. So I want to open it up for Q&A. What I tell my staff, if you don't ask the question, then I will fill the air. But I'd love to hear from you any questions that you might have on any subject. Which you'll find we're completely transparent. If we don't know, we're going to say we don't know. And we'll try to take it back and figure out answers for the questions that you have. I'm going to start us off by taking a little bit deeper conversation, and I'll let Dane will let me know if there are questions coming through the chat that we should be answering. I want to take us back to early detection. So my doctorate is actually in history, and it gives me a good lens on where we are and where we came from. In the 19th century, there was really this great revolution. It was called germ theory. It is when medicine first learned about bacteria and viruses and how they were contributing to disease, and it led to antibiotics and wash your hands and a whole set of things that really improved medicine. Early detection is of that scale. It is, the way I would describe it to you is, we've been driving around in a car in which we have no gas gauge. And the only time we know when we're running out of gas is when the car stops running. And that's a symptom. And at that moment, you know that you need care. What the science is now saying is we're about to give you a gas gauge so that you will see the onset of cancer or diabetes or Alzheimer's years, and I'm going to use the word years, before you get to be symptomatic. And guess what? There are medicines that are going to treat that. So let me be precise. So one of the things that we're screening for in the test that we're doing, the study that we're doing in Flint, is pancreatic cancer. So if you are diagnosed with pancreatic cancer, generally speaking, your life expectancy is pretty short. 5, 6, 7 months is not unusual for someone diagnosed with pancreatic cancer to pass away. And it's because the disease, its symptoms are really masked, and we only find it in the late stages when the disease has essentially metastasized. And we've had great leaders like John Lewis, who passed away from pancreatic cancer. And there have been other members of Congress as well that have been dear to the National Minority Quality Forum that have been diagnosed with pancreatic cancer and passed away. So right now, we are screening for pancreatic cancer with the hope that we can find signals of it before the individual gets symptomatic. And what's important about that, just announced last couple of months, that we have really the first treatment for pancreatic cancer. We didn't even have a treatment for pancreatic cancer. It's early stage, lots of work and discovery to happen with it. But here's the point. The point is that we have the ability now to screen for pancreatic cancer, early stage, a lot to learn about that screening, and it'll get perfected and it'll get better. But we'll also have a treatment, and that will get better as well. I was recently reading a report out of the University of Chicago that was making the claim that by the time we get to 2035, we will have really succeeded on the war of cancer. That the science and technology is there where cancer will no longer be a life-threatening disease, and that's part of the change. Dan, I don't know if we have any questions in the chat. Yep.
Hey, so we do have Pat in the chat. Not sure. Are you able to?
Did you put a chat in?
Yep.
You want to
Yep.
read the chat?
For sure. For sure. Pat dropped in to say that their teaching hospital, where they it does not do any blood work for cancer detection, and they service a diverse socially and racial community.
Well, welcome. Pat, are you in Flint? Are you a resident of Flint, or is your hospital in Flint? I love this. Dane is mediating for us.
We will see if we get an update in the chat here.
Okay, great.
Yep.
All right. So, as this work takes hold, one of the things that we've been saying about Flint is that Flint is the first early detection city in the country. Meaning, Flint has been known for its pioneering in the industrial age with automobiles, GM, etc., going back to the turn of the 19th century, 20th century, I'm sorry, where the whole industrial age was really pioneered and built in Flint. And people know that history very, very well. And certainly the people of Flint know that history very, very well. We're looking at a new age, this early detection age. And we want Flint to be a pioneer of that. And what I mean by pioneering of that is the science has to be perfected, the protocols have to be perfected. And so we are inviting the innovative companies to come to Flint and partner and build that science. And it's not just clinical, they'll bring jobs with it as well. If you look at San Francisco, for example, what the biopharma industry built in Flint, we hope to see that happen. Biopharma built in San Francisco. So if you go to parts of San Francisco, all of the biopharmaceutical companies are there, and they built a whole community. We are reaching out to the industry partners to come to Flint. Flint has a tremendous infrastructure. You have the University of Michigan, which Dr. Otang is a faculty there, but you also have Michigan State that's there. You also have Hurley Hospital. Obviously, you have Life in 3D, and we're really excited to partner with Danica and Dr. Otang. And you have a great community, a great history. And we think that this is a great moment where we can leverage that science and bring it to you. And that's why I wanted to take the moment to introduce you to the NMQF staff, because they're going to bring all of that work that they've been doing and learning, and essentially talk to you about it, get your sense of it, and hopefully um, uh, give you the ability to be really great advocates for your community. I tell everyone that advocacy is a branch of medicine, that if you're not advocating, if you're not setting policy, then it's not likely that you're going to get the best quality care. And to do that advocacy, you need data. You need to understand the complexity of the American healthcare system. And, Gretchen and her team, they work at that all the time. And Leo and her team crunch the numbers, and Manera and the SHC team, they're in community bringing that information to you. And we've got Adja and her team driving the social media. And so, we want to take all of the capabilities that we have and make them available to you in any way, shape, form that the community feels that it would be useful. Dane,
Hey, so we do have a question here. Anonymous person says that obviously privacy is a huge issue, and there is still a large segment of the population that mistrusts certain institutions, especially with their data. How will this program ensure the privacy of its participants?
So we go to great lengths to protect the privacy of those who we work with. And Venkata and Adam, who you were introduced to, they maintain what is effectively our community data lake, where we house all of our data. All of our data is de-identified. We don't know who anyone is. Anyone that comes into our study, or any record that we get of anyone, it has a unique code to it. And that code allows us to link across the various data sets that we may have for an individual, but we have no way of knowing who that individual is. And we have been certified by CMS on privacy, on security. So it is not just that we can't look at anyone's records, that our system has been hardened to the best of our ability to make sure that no one external can get into our system and gain access to the data that is there. We understand the mistrust. We understand where it comes from. As I told you, my doctorate's in history. I know the history. I know what communities have been exposed to, and disadvantages that they've occurred. But even more importantly, we want to listen to you. If you think for any moment that your data has been exposed, or something that NMQF is doing, or some third party is doing, that puts your data at risk, we want to know that, and we will act on it. And then finally, we work with, it's called an institutional review board. So if there's any violation in protocol, we are bound to report it. And so we have external monitors that look after the work that NMQF is doing. And Christina Edwards, who's on the phone, but you couldn't see her picture or her live, is responsible for all of that. So there really is a lot of effort that we put in terms of making sure things are protected.
All right. So we do have a few more questions here. Carl Robert asks, how will Flint LEADS benefit families in our community?
So I'm going to start with the test that we're doing. So these early detection tests affluent people are getting them right now. All right, you can go to your doctor. Some of those tests cost $1,000 a piece. And I sit in meetings and I hear reports from people of affluence who have taken these tests and have had their cancer detected. They don't live in high-risk communities, but they have the capacity to pay for the test. We want to make sure that as standard of care, that the people in Flint get these multi-disease tests. We want to know, or we want to help you know, really, what is my risk for Alzheimer's 10 years before I'm symptomatic, 5 years before the cancer shows up, 10 years before I have real signs of diabetes. That is not some future tense. That is what the system is capable of doing right now. It can do that right now. Obviously, the science will get better, but the folks that are coming into our study, they are having access to all of this new science. And the benefit to them, and obviously down the road to their family, is really important. But you're not just doing that for Flint. You're doing that for the broader community. When I say broader, I'm talking about Flint, I'm talking about the state of Michigan, I'm talking about the US. You are helping to write the future. You are helping to build a new healthcare system that doesn't delay your care, that gives you access to best modern therapy. And it is your voice, it is your advocacy that is going to make that happen. And what NMQF wants to do is facilitate that by giving you access to the data.
All right, so our next question here, if someone is interested in participating, what are the next steps?
Danica, that sounds like you.
Yes, it is. Thank you for asking that question. If you would like to participate, take a moment, grab a pencil, piece of paper. The website to go to is www.lifeindd.com or call 810-780-4189, and I'll place it in the chat for you as well.
Right. And we encourage you to come and join. You will be part of a multi-site, multi-system study that is going to be very, very important for the future of healthcare.
All right, so next question here. We have Mike asking, what does it mean to be an early detection city? How will the community access early detection testing?
I love that. So being an early detection city means that at the population level, I want to help you understand when I say at the population level, what that really means. It means that there's going to be a moment in time coming very soon when, as a matter of routine care, you are in the city of Flint. I'm going to leave it there for the moment. In the city of Flint, you will be able to get tests that will provide information to your doctor, your health system, about your health status, meaning, are you picking up a signal for cancer? I'm not symptomatic by current standards. Am I picking up a signal for Alzheimer's? by current standards, I'm not symptomatic for Alzheimer's. Am I symptomatic for diabetes? Do I understand any genomic risks that I might have, because we're collecting genomic data and we're looking for in populations, our genes as they get expressed can elevate the risk for cardiovascular, kidney disease, even if you have the sickle cell trait. That's really important for your doctor to know, because the way in which you're screened for a disease like diabetes is going to be informed by whether you have the sickle cell trait or not. We're trying to get that to the population level. You think about that at the population level, so that the cancer that is currently metastasizing, we can't get the signal, or the Alzheimer's or whatever, we are picking up that signal early. And what we're seeing is medicines are being developed to actually treat at that pre-symptomatic level. That's for the individual, but you're also writing the new standards. You are inviting that whole early detection world, the innovators in diagnostics, in pharmacy, in administrative protocols, in financial systems, in clinical guidelines, to be part of the conversation in Flint, because what they want to do is make sure that you live a long, good, high quality life. That's the work. And your experiences will inform what other communities will experience. And so that NMQF team that you were introduced to today, in their special areas, will be working with you to build that transformation. And also in their areas, bring those experts to your community to interact with you, to learn, to hear your needs, so that you can go back to your member of Congress, to your state legislator, to your county commissioner, and say, here's what I want, here's what my community needs, in a way that's really informative. And that's what it means to be the first early detection city, that you are the vanguard. You are creating a whole new future that people in the 20th century couldn't even imagine, couldn't even get their brains around what it is that you are now part of. And I want to take a moment to shout out to some of the support that we've gotten from Mayor Neely and the city of Flint, and Del Rico Lord County Commissioner, and the state of Michigan, and other policymakers who have, not breaking any confidence because they said it, who put themselves in the study. Because they wanted to show their commitment to that future and to build that trust. So you've got folks who are listening to you, who want to help, who want to drive that future. And so I think that's what it means to be early detection. But even more importantly, at the end of the day, it's going to mean what you say it means. Right? I mean, I can go on about all the hopefulness and whatever, but at the end of the day, you are the ones that are going to write that chapter of what that being the first early detection city actually means.
Well, I know we're running up on time here, but I
So,
do think we have a great question that we can close out with.
okay.
So Mike also asks, what are the key goals for the Flint Leads webinar series, and how can community members stay involved after today's session?
I'm going to say a few words. I'm going to turn it over to Angela on the communication side. I think the big story here is we need you to tell the story. We need you to paint that future. We need you to use your voice. I wanted to take this moment to introduce NMQF to you. The staff here, they are really committed to listening to you, to help make a contribution, to be a value add to the community. But as I said, at the end of the day, this is really about what you want, when you want it, and how you want it. And we can only listen, offer up what we can, but it is your future to write. And our communications team, through those webinars and other things, can make it. So I'm going to ask Angela to close us out on the communication side.
We can go to the next slide. I think it's just a thank you slide. But yes, Dr. Parker said it exactly. We're looking for ambassadors, community ambassadors, patient ambassadors. So the next webinar, which I believe will be July 14th, will be all about that. And then you will engage with Munira and her team regarding activities later on this year in community that we're looking for folks who want to participate in these educational events. And so please send us your contact information at communications@nmqf.org. If you would like to connect with us in between the webinars, that is communications@nmqf.org.
Well, everyone, I want to thank you for taking the time. And please reach out to us if there's anything that we can do for you. Please don't be shy. I think the folks at NMQF are really here to help, and we're looking forward to be really a good neighbor to the folks in Flint and really help make a contribution. So thank you so very much for the participation.